Okay, so Ingrid, you're asking how important is the role of stress and pressure in pressure and conflict in raising blood pressure in an individual who usually has low blood pressure. There are several layers and several components. Um, Number one, stress, pressure have what we call a stimulant effect, and they release two major stress hormones. One is long term, one is short term. The long term one is cortisol. Cortisol acts over a period of time. Adrenaline is the short term one, it's a fight or flight hormone. So it acts immediately. Now, when you expose to stress, physical stress, mental stress, emotional stress, this cortisol and adrenaline have the tendency, have the property of increasing your heart rate. Increasing your heart rate affecting your stimulant receptor cells. So your body quickens, your energy consumption increases. Energy consumption means more blood is flowing. More blood flowing means that the heart is pumping more. So blood pressure will go up. Now, if you talk about conflict, which is more of an emotional response or emotional stress, this one is even more significant because you have things like maybe you have a fight, or maybe you were in a traffic accident, or you had an argument, or something that spikes up your blood pressure. If you are the one that had low blood pressure normally, that is below about 100 over 100 over 60, a drastic change in blood pressure will give things like headaches, dizziness, palpitations, that is, you feel your heart beating or pounding. So that will give significant change. It's not life threatening, but if your blood pressure is usually low and you want it to come up, you have to pace out that exposure to the stress. For instance, physical exercise. This one you have to control over it. You are physically exercising to keep your blood pressure up so that blood flow will increase. After some time, the body would adjust. That's why we say, look, don't always sit down and be relaxed and be idle and be docile. Engage in physical activity. So someone that has low blood pressure, when you face pressure, stress, conflict, these hormones or these triggers are released, and over time the blood pressure will go up. If you now decide to relax, the blood pressure will go back to what your DNA, what your body is used to, what your body was manufactured to do. So stress is important, but stress that you have control over is better. Stress you don't have control over, the stress that you allow to go haywire, can be a problem. Can give things like heart problems, the heart muscles become enlarged, thick, loose. Can affect the blood vessels, the brain. We talk about stroke, we talk about angina, talk about blurry vision, eye problems, talk about kidney problems, talk about erectile dysfunction in men, talked about problems with ovulation and fertility and menstruation in women. So I hope this answers your question. I'll see you on the next one. Bye bye.